Here's a question that even the healthcare industry hasn't completely answered. Are hearing aids medical devices or are they technology? Believe it or not, the answer to that question may be one of the biggest reasons insurance coverage is so confusing. I'm Chuck Smith, owner of Affordable Hearing with locations in Rochester, Logansport, and Lafayette, Indiana. If you've been following this series, we've talked about how Medicare's decision back in 1965 shaped today's insurance landscape. We've talked about how hearing loss was once viewed as simply a part of aging, and we've talked about the financial side of hearing care. But there's another piece of the puzzle that most people never think about. Today's hearing aids aren't anything like the hearing aids your grandparents wore. They're basically tiny computers. Many of them can automatically recognize the environment you're in and adjust themselves in real time. They can connect directly to your smartphone. They can stream phone calls. They stream music. Some connect to your television. Many have rechargeable batteries. Some even use artificial intelligence to better separate speech from background noise. They really are among the most advanced wearable devices you could buy today. But here's where things get complicated. Hearing aids are also FDA-regulated medical devices. They're prescribed based on diagnostic testing. They're programmed specifically for your hearing loss, and they're fitted by trained hearing care professionals. So, are they healthcare? Absolutely. Are they technology? Also, yes. Then, in 2022, over-the-counter hearing aids entered the marketplace. Now, even adults with certain types of perceived mild to moderate hearing loss can purchase some devices without even seeing a healthcare professional. For some people, that's a positive development because it does help increase access. But it also created even more confusion. Consumers started asking, wait, if I can buy hearing aids off the shelf, why would insurance cover prescription hearing aids? Here's the difference. Buying a hearing aid is only one part of better hearing. The professional care that goes with it is just as important, if not more. Think about it this way. If you bought a piano tomorrow, would that automatically make you a pianist? Of course not. The instrument matters, but so does learning how to use it. Hearing aids work much the same way. A prescription hearing aid isn't simply a product sitting in a box. It's a part of a complete hearing healthcare process that includes diagnostic testing, programming, verification, counseling, adjustments, follow-up care, and long-term support. In fact, many people who wear hearing aids will tell you that the relationship with their hearing care provider is just as valuable as the technology itself. Insurance companies, however, have to decide what exactly they're paying for. The device, the professional services, or both. That's one reason hearing aids don't fit neatly into the traditional insurance model. Tomorrow, we're wrapping up this series by answering two important questions. Who actually does have hearing aid coverage? And could things finally be changing? Before you scroll, I want to know, before today, did you realize hearing aids were FDA-regulated medical devices? Or did you think they were simply electronic gadgets? Let me know in the comments below and make sure you're following because part 6 wraps everything together.